This is the video made by Derisha Amalia Putri, student of Business Leaders Executive, Magister of Business and Administrations, Institut Teknologi Bandung. This video presentation is intended for educational purposes only, as part of the final exam assignment for the Entrepreneurial Leadership course in the BLEMBA program at ITB. So let's begin. The leader who challenges the status quo, launching the Indonesia Affordability Program with multi-tier pricing for innovative medicines at Merck, Sharp, and Dome. Indonesia's healthcare landscape is marked by a dual market structure, public reimbursement through the GKN system, and a fragmented private sector. This dichotomy presents both opportunities and challenges for multinational pharmaceutical companies seeking to expand access to innovative therapies. As the head of the oncology business unit at Merck, Sharp, and Dome, Indonesia, I led the development and launch of the Indonesia Affordability Program, IAP, a strategic initiative aimed at transforming access to high-cost cancer medications through an equity-based pricing model, a mechanism that has never been utilized in Indonesia. Merck Sharp and Dome Indonesia is the local affiliate of Merck & Co., Rahway, New Jersey, USA, known as MSD outside the United States and Canada. Established in Indonesia in 2005, MSD Indonesia operates from its headquarters at Menara Astra Tower, Jakarta. Globally, MSD has a legacy of over 130 years in pharmaceutical innovations, and in Indonesia continues these traditions by focusing on innovative medicines and vaccines that address critical health challenges. MSD Indonesia concentrates on two primary therapeutic areas: oncology. MSD is a leader in cancer treatment, with its flagship product Keytruda or pembrolizumab playing a central role in immuno-oncology treatment. The company is actively involved in expanding access to cancer therapies and supporting healthcare professionals through education and training. On the other hand, MSD Indonesia also focuses on vaccines. MSD provides a range of vaccines aimed at preventing infectious disease, contributing significantly of public health efforts in Indonesia. The Indonesia Affordability Program was conceived as a transformative initiative to redefine equitable access to innovative cancer therapies in Indonesia. As the project lead, I, Derisha Amalia Putri, spearheaded the development and launch of this program under the strategic directions of George Silianu, Managing Director of MSC Indonesia, in collaborations with the Asia Pacific subject matter experts and also the local team. The project objective of Indonesia Affordability Program. The IAP was initiated to address a critical and persistent challenges in the country's healthcare system, specifically Indonesia. The affordability gap for innovative cancer therapies, particularly Keytruda or pembrolizumab. MSD's leading immuno-oncology product, despite its proven clinical efficacy and global recognitions, Keytruda remained inaccessible to a large segment of the Indonesian's populations due to high out-of-pocket costs, limited public reimbursement, and fragmented healthcare infrastructure. This IAP was designed to challenge the status quo by introducing a comprehensive means testing algorithm that enables equity-based pricing. This innovative model segments patients into multiple pricing tiers based on verified socioeconomic indicators, such as income, asset ownership, hospital type, insurance status, and geographic locations. By doing so, the program ensures that support is proportionate to need while maintaining pricing integrity, traceability, and sustainability. Ultimately, the objective of the IAP is to expand access to innovative medicines in a way that is fair, data-driven, and scalable, setting a new benchmark for affordability programs in emerging markets like Indonesia. The IAP journey unfolded over a structured timeline, reflecting a blend of strategic planning, cross-functional collaborations, and agile executions. The project began in October 2024 until January 2025 with the ideations and infrastructure assessment stage. The project began with a comprehensive means testing infrastructure design supported by market research from IQVIA. External assessments were conducted across public and private hospitals to evaluate readiness for the multi-tier pricing model and voucher-based discount mechanism. Continued in February to March 2025, proposal development and business case finalizations. The team developed a robust business case, including deal versus no deal scenarios, patient segmentations, and revenue impact modeling. The proposal underwent internal reviews and was finalized by 26 March 2025, aligning with MSD's global pricing and compliance frameworks. From April to June 2025, operational alignment and legal review. Key operational mechanisms such as voucher generations, hospital enrollment, and discount reconciliations were refined. Legal assessment confirmed the feasibility of implementing multi-discount scheme in Indonesia, paving the way for program approval. Finally, July until August 2025, go-to-market preparations. A transition from free goods model to direct discount via voucher was developed. Pre-launch activities including hospital onboarding, healthcare professional engagement, and insurance partner alignment was initiated. There are four main leadership challenges that I faced throughout the project commencement. First, challenging traditional norms. The project lead questions and stretches norms to drive innovations in pharmaceutical access program. Second, equity-based pricing model. The new pricing model segments patients via means testing, promoting fairness and sustainability. What is means testing? Means testing allows for targeted affordability, ensuring that patients from low-income or underserved regions receive deeper discount, while those with private insurance or higher asset contribute more. This aligns with the principles of social equity and financial sustainability. This data-driven approach enables segmentations of patients into different discount systems. Delivered via digital and physical vouchers, the model ensures that patients receive support proportionately to their financial capacity, while maintaining pricing integrity for MSD itself. Third, transparency and compliance. Voucher-based discount ensure transparency, traceability, and compliance with global standards. At that time, we faced difficulties in implementing the previous program, which is the uniform pricing models that fail to account for the socio-economic diversity of Indonesian populations. And also, the free goods model that are lack of traceability in free goods distributions make it difficult to monitor real-world impact, hard to ensure compliance, and conduct meaningful audits. And the last is sustainable access solutions, empowering hospitals to participate in a scalable, sustainable pharmaceutical access program. The five leadership practice in launching the Indonesia Affordability Program based on quizzes and posters, the leadership challenges. First, model the way. Modeling the way means more than setting directions. It means living the values I was advocating for. Internally, I encountered resistance from teams who were concerned about the complexity and perceived risk of abandoning the legacy model. Externally, hospital questions the feasibility of implementing means testing, and physicians worried about patients' confusions. In these moments, I remain consistent and transparent, reinforcing the long-term visions and ethical imperative of equitable access. I led by example, engaging in open dialogue, listening to concern, and demonstrating how the new model could be both compliant, scalable, and impactful. My commitment helped build trust and gradually shift perspective. The lesson learned that I got. Leadership begins with clarity. but it is sustained through consistency and convictions. Modeling the way is about embodying the principles you expect others to follow, especially when the path forward is unfamiliar or uncomfortable. I learned that when leaders walk the talk, they create a culture of trust and accountability. In the case of IAP, this approach was instrumental in aligning diverse teams and stakeholders around a shared mission. It laid the groundwork for change, providing that values-driven leadership is not just aspirational, it is operational. Second, inspirations for a shared visions. During the ideation phase of the Indonesia Affordability Program from October 2024 to January 2025, I led a series of cross-country workshops involving teams from Singapore, Vietnam, and the United States. The sessions were designed not only to co-create the operational framework of the program, but to align on a shared visions. My vision statement at that time as a project lead was, we envision a future where every Indonesian patient, regardless of income, can access MSD innovative medicine through a fair, needs-based system. The Indonesia Affordability Program transforms affordability from a static concept into a dynamic model rooted in equity and shared responsibility. Together, we are building a bridge to healthcare access that is sustainable, inclusive, and deeply human. Inspiring these visions was not without its challenges. Internally, I had to overcome skepticism from colleagues who were accustomed to legacy models and concerned about the complexity of implementing a multi-tier pricing system. And also externally, I faced hesitations from hospital, physicians, and patients who were unfamiliar with the concept of means testing and wary of change. This experience reinforced that a compelling vision is the cornerstone of transformational leadership. When people understand the why behind a change, especially one as disruptive as equity-based pricing, they are more likely to engage, contribute, and advocate. I learned that inspiring a shared vision requires empathy to understand stakeholder concerns, clarity to communicate the destinations, and courage to lead through uncertainty. Third, challenge the process. Challenging the process was far from easy. Internally, I faced resistance from teams accustomed to legacy model. Convincing colleagues to move away from the perceived simplicity of one-price-fits-all schemes required persistent communications, data-backed advocacy, and a clear articulation of the long-term risks, such as leakage of free goods and unsustainable patient reach. This experience taught me that innovations demands discomfort. Challenging the process is not about defiance. It's about leadership that dares to envision better outcomes. I learned that disrupting an entrenched system requires more than a good idea. It demands empathy, persistence, and coalitions building. By staying anchored in the purpose, improving access for patients in need, I was able to guide the organizations and its partners through uncertainty toward a shared goal. The IAP is now a testament to what can be achieved when leaders are willing to confront limitations and reimagine what's possible for healthcare equity. Fourth, enable others to act. The success of Indonesia Affordability Program was only possible because of the collective effort of a highly diverse and cross-functional team, from finance and IT to medical, regulatory, and market access. Each function played a critical role in building and launching the program. As a project lead, I intentionally delegate ownership, encourage interdepartmental collaborations, and create safe spaces for experimentations. Empowering others required me to shift from directive leadership to facilitative leadership. I had to trust my team's expertise and give them room to lead within their domains. This was not always easy, especially when timelines were tight and the stakes were high. Some functions were initially hesitant to take ownership of unfamiliar tasks, while others needed reassurance that their contributions were valued. What are the lessons learned? Empowerment is not just about delegations, it's about trust in actions. When leaders enable others to act, they unlock collective intelligence, creativity, and resilience. I learned that great leaders don't just build great strategies, they build great teams. The last is encourage the heart. I hope people remember me as a leader who not only challenged the system to make healthcare more equitable, but also built a culture where every team member felt empowered, appreciated, and inspired to make a difference for patients in need. In a high-pressure, cross-functional project like Indonesia Affordability Program, it's easy for teams to become consumed by deadlines and deliverables. I realized early that sustaining momentum required more than operational alignment. It demanded emotional connections. I made it a point to recognize not only the visible wins, but also the quiet, behind the scenes effort that made those wins possible. Whether through team shout-outs, personal message, or sharing patients' impact stories from the field, I ensured that every contribution felt seen and valued. Encouraging the heart is essential to building resilient teams. In high-stakes, transformative projects, burnout is real risk, and morale can waver without intentional leadership. I learned that celebrating progress and acknowledging effort is not a soft skill. It's a strategic imperative. When leaders take time to connect emotionally, they reinforce the why behind the work and inspire teams to go further. The Indonesia Affordability Program's early success is not just a result of a strategy and executions. It's a reflection of a team that felt empowered, appreciated, and united by shared missions to help patients in need. How about the project impact? Over the past 2 months, I led the successful launch and rapid expansions of the Indonesia Affordability Program, a strategic initiative designed to transform access to MSD's innovative medicine through equity-based pricing. As a project lead, I championed a patient-centric vision, mobilizing a cross-functional team across commercial, medical, regulatory, and market access functions. The impact of this leadership effort has been profound. Within just 2 months, over 80 hospitals across Indonesia enrolled in the program, resulting in 300% increase in the new patients reached compared to the previous conventional model. This growth reflects the strength of collaborative executions and the power of leading with empathy and purpose by aligning business goals and social impact. The IAP has become a testament to what can be achieved when leadership is rooted in the shared values, strategic innovations, and relentless focus on improving patients' outcomes. That's all from me. Thank you.